Another common area that we are asked about by patients is related to their arms. So sometimes after weight loss or sometimes after having kids, patients find that they either have a little bit of extra skin or a little bit of extra bulk on their arm. There's different ways of treating that. If the patient has good skin and just a little bit of extra fat, we can simply do a liposuction procedure, which is minimally invasive and no or very, very minimal scars, little downtime. And it's good for patients with good skin quality, good elasticity of the skin, that just have a little bit of extra fat. It's usually in this part of the arm over here. On the other extreme is patients that have lost a lot of weight and they have significant extra skin on their arm. So when they bring their arm up, there's a flap of skin underneath their arm that aesthetically bothers them and also functionally gets in the way of a lot of movement. So when they're trying to do sports or doing activities, they have extra skin in the way. So it actually interferes with their daily life. In that case, we do what's called a brachioplasty or arm lift, where we remove this extra skin through surgery done under general anesthesia. And we basically cut out a large ellipse of skin on the inside of the arm and then close it up after to tighten and firm the arm and remove all the unwanted skin. We have to realize that removing any skin will leave a scar. We place the scar in an area that is the least visible possible. So it's usually on the inside of the arm, sometimes on the back of the arm as well. But it's a trade-off. So if you have a lot of extra skin, the patient does have to realize that there is a scar involved. There's also an in-between patient that has a little bit of fat on the underside of the arm, a little bit of extra skin, that doesn't necessarily want to go through a major surgical intervention, and also more importantly, doesn't want to have a permanent long scar on the inside of their arm. For that, there's a relatively new technology called BodyTite, which is a radio frequency energy that we deliver to the skin and to the tissue of the patient that causes a firming of the arm. It's great for people that have some extra skin, don't want to have a scar, and also don't want to go through a lot of downtime. Again, this is it's a technology that's not for everybody. If there is too much extra skin, the results of BodyTite won't be enough for it to be worth it to go through the procedure, but it's for the more in-between patients. And again, it's during consultation process that the patient and the doctor can discuss the pros and the cons of each option and then choose the right treatment plan for them.